The Alzheimer's Association says 580,000 people over the age of 65 are living with Alzheimer's in Florida. This comes as an advisory committee for the FDA just voted to endorse Eli Lilly's Alzheimer's drug designed to slow the progress of early stages of Alzheimer's disease. The director of St. Mary's Memory Disorder Center, Dr. Arif Dalvi, is here to talk more about this with us. Doctor, before we dive into everything, what would this drug possibly do for patients?
So the idea is, imagine you live in a beautiful neighborhood, nice and clean, and then the garbage people don't show up for about 2 months. It's going to be a mess. Something similar happens in the brain with Alzheimer's. There's a protein called amyloid that accumulates and it's not cleared. This drug and others like it attempt to remove the amyloid from the brain because if it is left there, it damages the neurons, the brain cells.
So it seems like there is progress being made?
This is certainly one of the few approaches that specifically addresses an underlying pathology of Alzheimer's disease.
Okay, doctor, I want to talk a little bit about just, the signs and symptoms that people should look out for. Sometimes, maybe we think, oh, we're just being a little forgetful, but it's important to pay attention.
Certainly. I think some of the things that should be red flags are things like losing yourself on a route that you're already familiar with, or let's say you enjoy working in the kitchen and a recipe you worked with for 20 years, suddenly it becomes difficult for you. Those are the sort of subtle things that should raise a red flag and suggest that you should seek evaluation.
And not just for the individual, but maybe for family members and friends to watch out for those signs as well.
Absolutely.
Okay, so how significant is the role of genetics in Alzheimer's?
So the traditional familial Alzheimer's is actually quite uncommon. There are certain mutations like the presenilin mutation that are associated. But there are certain risk factor genes, the most important of which is the ApoE gene, which we are testing for as a potential marker for Alzheimer's disease.
What are you seeing over at St. Mary's Medical Center?
So what we have started at St. Mary's is now a formal diagnostic protocol that specifically diagnoses Alzheimer's disease. So we look for amyloid in spinal tap fluid, we look for the ApoE gene, we look for MRIs looking at certain areas of the brain, and we put it all together to have a specific diagnosis of Alzheimer's.
Okay, so what are some of the effective strategies for families and caregivers to support their loved ones?
So screening for preventable causes, certain vitamin imbalances, hormonal imbalances early on can be very helpful. And a lot of Alzheimer's can be defeated by, or dementia can be defeated or postponed by lifestyle factors. So simply paying attention to heart health, control of cholesterol, blood sugar, high blood pressure is very important. Checking your hearing from time to time, because loss of hearing can explain 1 out of 9 dementias.
Wow.
Regular exercise and a diet such as the Mediterranean diet or a specific version called the MIND diet can be very helpful.
Okay, Dr. Dalvi with St. Mary's Medical Center, thank you so much for being here with us this morning. If you want more information, you can head to our website at WPBF.com. And a programming note, it is Men's Health Week, and tomorrow on WPBF 25 News Mornings, we're going to look into the impact that Alzheimer's can have on men. 3 warning signs experts say families should watch out for. That's tomorrow morning starting at 6 a.m. on WPBF 25 News Mornings.